My name's Shannon. I'm a physiotherapist in the Division of Rehab. I've been working here over 15 years now. I love working in rehab and I feel really strongly about helping people recover from their conditions or helping them manage conditions that they've been living with for a while.
My name's Linda. I live in Broken Hill, but I was in Adelaide having surgery at the Royal Adelaide when I had a stroke. It's pretty busy here and I already come 3 days a week. But you've got to fit in with everybody else, obviously, who needs to have therapy. The tele-health enabled me to have extra sessions without impacting on anybody else's.
Initially I was hesitant. From a physio perspective, I can't replicate exactly what I do in the clinic to people via tele-rehab. So I think initially I was really hesitant. I've learnt over time that's a very valuable part of what we do. So if I can help people be active at home and help them build their confidence to do more activity at home, then I can influence their behaviour and their belief about what they can do. And if I can improve their ability to manage at home every day of the week, then I know that their outcomes are eventually going to be better.
You do have a really good opportunity. It's very focused one-on-one therapy, usually. Here in the building, which is great, like if I'm in the gym with, sometimes 10, 12 other people. So it's very distracting. Lots of other activity going on, whereas when you're doing the telehealth, it's very focused on you and you can concentrate and focus better, and so can your therapist.
It's a huge part of what we do. It's great to see people moving in their home environment. In a clinic it can be very scripted and very controlled. So to see instinctively how they move at home gives us great insight and allows us to probably engage them more authentically with their behaviour. And if you're having any trouble with managing your therapy or activities at home, it helps us help you problem solve that.
I don't think it's tricky. I've had the benefit of having like face-to-face care as well, and then just using the tele-rehab as a follow-up to that, which has been really good. The best thing about it is that my family get to see what I'm doing and can then work with me and encourage me after that, like to do exercises at home. They actually see me work with the physio or OT and know exactly what I'm supposed to be doing, and that's been really helpful in terms of them reinforcing that.
Tele-rehab's a really important part of our therapy. Anyone over 18 up to any age. So we see people in their 90s. So it might be someone who has had a sudden event, whether it be a stroke or a car accident, surgery or a fall and a fracture. And so then they're leaving hospital and needing some rehab to get them back on their feet again and get them back to their independence. Or we might be seeing someone who is currently living in the community with a chronic condition, whether it be frailty, falls and history of falls, or with MS or Parkinson's. There are some really clear benefits to using tele-rehab. I mean, for people that live remotely or live further away or have limited access to transport, they suddenly can access a specialist service.
I don't have to worry about anything or having transport or anything. I just literally have to be able to switch the iPad on and it's there. Well, I've been sick a couple of times and I haven't been able to come because I didn't want to pass the infection onto staff or other patients, but I've been able to continue with the sessions at home via telehealth. That's been a really good benefit as well.
It's important to highlight that what we're trying to achieve is more therapy for them at home across the entire week. In order to get the outcomes that most people want, they need to do more than just come into a clinic a couple of times a week. So this is the way that we can genuinely support them to do more in total across the week, across the months, and when the rehab finishes. They're going to continue to recover depending on how much they can do themselves at home.
I found it really good because, when I woke up after the stroke, I couldn't move. Basically fully independent, even though I don't have the full use and function of my hand back. But I've gotten to the stage now where, I can literally look after myself. So I only have the rehab to thank for that.
Group tele-rehab is probably newer than tele-rehab. I think it's really valuable. We are hearing repeatedly from people coming into us that people can feel isolated, either if they've had a sudden medical event and they're surrounded by people who are well, or if they've been living with a condition for a long time, can be a feeling of isolation. So it's important to enable them to be able to connect with other people, to be able to talk together, and they get an understanding that people are going through similar things.
Listening to other people's stories, that's always really helpful because my family don't understand what I've been going through. even though they say they obviously understand, but they really don't, how difficult and frustrating it is. So it's really nice to hear stories from other people so you don't feel so stupid and alone. I think you are more encouraged to keep going because, at various times you just want to give up. It's just hopeless, like it's no point doing this. Telehealth, you get to see a different variety of people and hear different stories and hopefully different success stories.
We need to make sure that tele-rehab is safe. So we need to consider that it's not appropriate for every single person. There are some people who might not be able to see or hear or manage the technology at all. But for the majority of people, it is safe. So we can assess their situation, use additional equipment, have them set up in a safe way or have a carer nearby to allow them to be able to engage because the benefits are there and we want to support them as best we can to try and engage with it.